This webinar is presented by the New York City Department for the Aging's Health Insurance Information, Counseling, and Assistance Program, HIICAP. HIICAP provides information on Medicare and related insurance to people in New York City. This webinar focuses on Medicare Part B eligibility and enrollment. Part B is the part of Medicare that provides medical coverage, including physician visits, lab tests, x-rays, ambulance services, emergency room care, outpatient services, and therapy, among others. To qualify for Medicare Part B, you need to be 65 and a citizen or permanent resident for at least 5 years, or under 65 and collecting Social Security disability insurance benefits for 24 months, or have end-stage renal disease. You do not need a work history to qualify for Medicare Part B. The 10-year, 40-quarter work requirement is to qualify for premium-free Medicare Part A, which is inpatient hospital coverage. Most people qualify for Medicare at 65 and will be focusing on how and when to enroll in Medicare Part B at 65. The Social Security Administration handles enrollment in Medicare. You may remember when the full retirement age for Social Security benefits was 65. Back then, you went to Social Security and signed up for both Medicare and Social Security benefits at 65. But now, the full retirement age for Social Security is approaching 67, and many people are working later and delaying the collection of Social Security benefits. And because you don't receive any notice in the mail to enroll in Medicare, it is important to know about the enrollment process. Now, some people will be automatically enrolled in Medicare. These are the people who are collecting Social Security benefits prior to turning 65. These people, and only these people, will be automatically enrolled in Medicare. If you are not collecting Social Security benefits prior to turning 65, and you want your Medicare Part B to start at 65, then you need to know about the initial enrollment period. If you're enrolling in Medicare Part A or both Medicare Parts A and B during your initial enrollment period, you can enroll online at www.socialsecurity.gov. You can also call Social Security to enroll at 1-800-772-1213. The initial enrollment period is the first opportunity that people have to enroll in Medicare. This initial enrollment period refers to the 7 months surrounding the month in which you turn 65. These are the 3 months before your birthday month, the month of your birthday, and the 3 months following. But when you reach out to Social Security to enroll in Medicare will determine when your Part B coverage will begin. I will first explain the timeline, and then I will illustrate it with an example. If you enroll in the 3 months before you turn 65, your Part B will start on the first of the month in which you turn 65. If you enroll in the month of your birthday, your Part B will start 1 month later. If you enroll 1 month after your birthday month, your Part B will start 2 months later. And if you enroll 2 or 3 months after your birthday month, so in the last 2 months of your initial enrollment period, your Part B will start 3 months after the month you enroll. So say, for example, that you turn 65 in April. If you enroll in Medicare Part B in January, February, or March, your Part B will start on April 1st. If you enroll in April, your Part B will start May 1st. If you enroll in May, your coverage will start 2 months later on July 1st. If you enroll in June, your coverage will start 3 months later on September 1st. And finally, if you enroll in July, the last month of your initial enrollment period, your coverage will start 3 months later on October 1st. Most people would be well advised to enroll in Medicare Part B using the initial enrollment period when first eligible. However, if you are working, or if you have a spouse who is working, and you have health insurance through that current active employer, you may be able to delay enrollment in Medicare Part B past 65, and then use what's known as a special enrollment period to enroll in Medicare at the time that you're losing that health coverage. A few notes before going into the details of the special enrollment period. Number 1, The coverage must be based on your employment or that of a spouse. Health insurance coverage through a domestic partner does not allow you to qualify for a special enrollment period. Number 2, the coverage must be from an active employer. COBRA coverage is not coverage from an active employer, and so COBRA coverage does not allow you to delay enrollment in Part B without penalty. It is always advisable, number 3, it is always advisable to confirm with your employer how their coverage coordinates with Medicare. While Medicare will allow you to delay enrollment in Part B past age 65 if you have that employer-based coverage, sometimes the employer's policy, especially those from small employers, require that you enroll in Medicare if you are eligible for Medicare. While HIICAP can advise on Medicare, it's always advisable to check on the employer side as well. The special enrollment period lasts for 8 months following the loss of active employer-based coverage. If you are planning your retirement, you can reach out to Social Security up to 3 months before you want your Part B coverage to start and specify your desired start date. But you also have 8 full months following the loss of employer-based coverage to enroll in Part B without delay or penalty. To use the special enrollment period, you will need to have the employer complete the CMS L564 form, which you will submit together with the CMS 40B, the application for Part B, to Social Security. The form that the employer must complete should document that you've had active employer-based health insurance coverage since the first month you turned 65. If you've had more than one employer since turning 65, you'll need each of those employers to complete a separate L564 form. So basically, you will need to show Social Security that you've had employer-based health insurance coverage since the first month you turned 65 in order to qualify for the special enrollment period. If both you and your spouse will be using the special enrollment period, you will need the employer to complete a separate L564 form for each of you. Typically, it is advisable to make an appointment at your local Social Security office to submit these forms. If that is not an option, please reach out to HIICAP and we can advise you on how to submit your information to Social Security to enroll in Part B using the special enrollment period. If you did not enroll in Part B using your initial enrollment period, and you do not qualify for the work-based coverage, and you do not have the work-based coverage to qualify for the special enrollment period, then you can enroll in Part B during the general enrollment period. The general enrollment period runs from January to March of the calendar year, with Part B coverage beginning on July 1st. So you can see that using the general enrollment period will result in your Part B coverage having a delayed start date. In addition, you may be subject to a late enrollment penalty for enrolling late in Part B. The late enrollment penalty is a 10% premium penalty for each 12 months that you went without Medicare Part B, that you didn't have either Medicare or employer-based coverage. The penalty is based on the current year's Part B premium, and there's no limit as to the penalty. So if you went without Part B for 2, 3, 4 years or more, your late enrollment penalty could be 20, 30, 40% or more. This penalty can only go away under extremely limited circumstances. Once you enroll in Medicare Part B, regardless of which enrollment period you use, you'll receive your Medicare card in the mail reflecting Part B enrollment and your effective date. Please be in touch with HIICAP with any Medicare questions. You can reach us by calling 212-244-6469 and asking for HIICAP. You can also learn more about Medicare on the New York City Department for the Aging's website, including information on our Medicare orientation sessions. Thank you, and be well.